When an athlete tweaks a muscle or a desk worker develops a chronic ache, the standard advice is often to go get a massage. It is a common assumption that a physiotherapist's primary role is to manually rub away the sensation of pain. Sarah arrives at her clinic at 7:30 a.m. to prepare for a fully booked day. Her work is governed by strict clinical protocols and national law. Every consultation she performs is a medical interaction, held to the same professional standards as a visit to a GP or a hospital specialist. In the UK, physiotherapist is a legally protected title. To use it, a practitioner must complete a university degree involving hundreds of hours of supervised clinical placement. They must also register with the HCPC, the Health and Care Professions Council, the regulatory body that ensures all practitioners meet national standards. Most are also members of the CSP, or the Chartered Society of Physiotherapy, which confirms their status as a chartered professional. This medical training is the reason why certain physiotherapists can become independent prescribers. Since 2013, those who complete advanced HCPC-approved training can prescribe medications, including painkillers and anti-inflammatories, that are directly relevant to a patient's treatment. Because they can manage these care pathways from the first appointment, physiotherapists offer a direct route to recovery for musculoskeletal issues, often reducing the administrative pressure on local GP surgeries. Sarah begins her first consultation by moving past the patient's immediate complaints to conduct a clinical investigation. She starts with a physical assessment, measuring range of motion in the joints, testing muscle power against resistance, and identifying the specific movements that trigger the patient's symptoms. Sarah is assessing the body's kinetic chain, the way different segments of the body work together to move. In this case, the patient feels pain in their knee, but Sarah's assessment reveals that the knee is actually being overloaded because of a lack of structural stability in the hip. Using this data, she builds a treatment plan designed to correct the mechanical error. The plan involves a combination of manual therapy and specific exercises tailored to the patient's unique biomechanics. By addressing the biological cause and effect that created the injury, Sarah ensures the patient's recovery is built on a stable, long-term mechanical foundation. With the plan in place, the active treatment phase begins. Sarah uses manual therapy to mobilize stiff joints and works directly with the patient to ensure they are performing their therapeutic exercises with precision. She may also utilize specialized technology, such as ultrasound to promote tissue healing, or hydrotherapy, which uses the buoyancy of water to allow for movement that would be too painful or difficult on land. To manage the volume of care, Sarah works alongside a physiotherapy assistant, often called a support worker. The assistant is a constant presence in the gym, providing the patient with ongoing guidance and encouragement. The lead physiotherapist holds clinical accountability for the diagnosis and the overall plan, while the assistant monitors the patient's daily progress, ensuring each exercise is completed safely and reporting any changes back to the lead. This collaborative approach ensures that the patient's rehabilitation pathway remains consistent and safe from the initial assessment through to their final session. While Sarah focuses on musculoskeletal care, the profession covers the entire spectrum of human health. After qualifying, many physiotherapists spend years specializing in high-stakes clinical environments. Neurological physiotherapists work with patients whose nervous systems have been damaged by a stroke or conditions like multiple sclerosis. Their role is to help the brain and body retrain themselves to coordinate even the simplest movements. In the ICU, or intensive care unit, a hospital ward for the most critically ill patients, respiratory physiotherapists manage the mechanics of breathing. They use airway clearance techniques to help patients with cystic fibrosis or those recovering from severe illness rebuild their lung capacity. Pediatric specialists support children meeting developmental milestones, while women's health physiotherapists provide evidence-based care for pelvic floor dysfunction and pregnancy-related recovery. These practitioners are essential components of the hospital ecosystem, providing the movement-based expertise required for patients to regain their independence. There are over 65,000 registered physiotherapists currently practicing across the UK. For a patient, navigating this landscape usually means choosing between two pathways, the NHS or the private sector. Most practitioners are employed by the NHS. This care is free at the point of use and provides access to a broad team of medical specialists, though wait times for non-urgent cases can be significant due to high demand. In the private sector, the clinical standards and qualifications remain exactly the same. However, private clinics typically offer faster access to appointments and longer one-on-one session times. Regardless of the setting, both routes use the same evidence-based techniques. The choice is a matter of how a patient prefers to access the service, not a difference in the quality of the medical care itself. As Sarah finishes her day, she has helped patients ranging from office workers to those recovering from complex surgeries. Her role is multifaceted and highly technical. The ultimate goal of every physiotherapist is the restoration of movement and function, helping patients move from a state of injury back to their full independence. Before booking your first session, you should always verify your practitioner's credentials. You can check the HCPC register online at any time to confirm that your physiotherapist meets the national standards required for safe and effective practice. Seeing a physiotherapist means partnering with a medical expert who understands the mechanics of your body. It is a process of investigation and rehabilitation designed to get you back to your best.